Good evening. I'm Erica Lath, and I'll be your moderator this evening. Welcome to our discussion hosted by NFL Alumni Tennessee and Vanderbilt Health. Now, the goal of this evening is really to talk about health and wellness. We'll also be talking a little about any concerns our listeners have about COVID. We've got a great lineup tonight, including some of the state's foremost health experts, as well as former Tennessee Titans and NFL greats for all the football fans in the house. We are pleased that Tennessee Health Commissioner Dr. Ralph Alvarado is joining us, along with Dr. Sapna Kripalani, Assistant Professor of Medicine at Vanderbilt University Medical Center. We've also got Dr. Jermaine Davis, Assistant Professor at the School of Medicine at Meharry Medical College. And we are delighted, if you're a Tennessee Titans fan like I am, to have some former NFL greats joining us tonight. We've got NFL Alumni Tennessee Chapter President and All-Pro linebacker Al Smith. Former Tennessee Titans tackle and two-time Pro Bowler Brad Hopkins is in the house, along with former Tennessee Titans Pittsburgh Steelers All-Pro quarterback Neil O'Donnell. So a power-packed lineup, but folks, don't forget tonight is really all about you and getting your questions answered. So right now, be thinking of your questions. Feel free to type them into the chat. We'll get to those a little later in the program. But before we get to some of those health questions, let's set the scene and talk a little football. I'm going to direct my first question to Al Smith, president of the NFL Alumni Tennessee Chapter. Al, welcome in. Always great to talk to you. I know there's a lot going on with NFL Alumni Tennessee in terms of health initiatives to help people right here in the state of Tennessee. And we've got a very exciting Gear Up Tennessee campaign going on. Tell us a little bit about that.
Well, we're very excited to have this Gear Up campaign and partnering with the Tennessee Department of Health, along with tonight Vanderbilt Health, to have statewide awareness and raise awareness with this effort as far as going out to the different areas, as far as the community, as far as educating Tennesseans about health and wellness and getting them understanding everything that they need to know about everything as well. Because the Tennesseans are improving their health and wellness, including supporting their immune systems and getting boosted and taking care of them. Our main thing with the NFL alumni, and one of our main missions, is caring for our own, caring for kids, and caring for our community. And this initiative gives us the opportunity to give back to the community that has served us so well as former players, and giving back to them and being able to help them and being able to ask questions and do the things that they need to do to be able to make sure that they stay healthy, keep their health and wellness going forward. So we're very excited about that and being able to help and serve the community that has served us so well over the years.
Awesome, Al. Thank you so much. All right, next I'm going to get Brad Hopkins and Neil O'Donnell in here to talk a little more football. How often do you get to interview both these guys at the same time? This is absolutely awesome. Guys, we just had the NFL Combine. We know that the NFL Draft is coming up soon. I want you to put on your coach's hat for a minute and tell us, what do the Tennessee Titans really need to buckle down and do to get ready for next season?
I look at it right now. I kind of, it is Sweet 16. We know it's basketball right now, but football's going to come around pretty quickly. I look at what the Titans have done right now, and they've been very, very, very quiet. They've had a lot of players leave the franchise and go to other teams. So I do believe that come draft day or right after draft day, there's going to be a big major announcement, because let's not forget, we do need a lot of needs. We do need some corners. We need some offensive linemen. We need a pass rusher. We need a tight end now. There's a lot of needs for this team right now. So I look at it right now. They're trying to cut the salary cap, get it way below where they want, and they have something for us. I promise you. I'm a season ticket holder. I go to every game on Sunday, but I think they've been so quiet in free agency. I think the draft is really going to shock some people and want to get excited for this upcoming season.
All right, thank you. And Brad, what about you? What's your coach's corner analysis?
Well, I think the one thing the Tennessee Titans were missing last year from their offense was a deep threat. And I'm not sure if they're trying to develop that from the draft, or if they're going to maybe go find a big name free agent, which they can afford to fill that void. But I think that that's something that they're thinking about. And of course, with a bunch of veterans leaving the lineup up front, they were tasked with protecting the pocket. When you have guys retiring, when you have guys, just basically leaving to the lineup, you've got to replace them with somebody. Now, whether they'll be in a draft or through free agency, I don't know. The guys that have come in more recently, they're probably guys who will be around maybe camp, but they're probably not the legitimate answer long-term for what's ailing them up front. So I kind of I tend to agree with Neil as far as the cornerback situation, but I think receiver, maybe even an offensive line, may be the thing that they go with first.
All right, awesome, guys. I sure hope the Titans coaches are listening. That sounds pretty good to me. All right, let's move over and get into our health topics tonight. Dr. Alvarado, we understand you were appointed health commissioner of the Tennessee Department of Health by Governor Bill Lee in January of 2023. You've spent nearly a decade in public service. You've also served in numerous leadership roles in healthcare. Honored to have you here tonight. And to kick off our discussion, just outline some of your objectives and priorities for the department as you all continue working to improve the lives and health of all Tennesseans.
Well, first of all, thanks for having me on with everybody, all these great football players. I'm a football fan as well. I've been a season ticket holder watching football games for 18 years. But a lot of the things we're trying to work on here in Tennessee, one of the things I think that's, as I've met a lot of people in different health departments and had a chance to meet food seems to be a thing that keeps rising to the top. We're looking at things just that how many families where their next meals are coming from. We're working on different aspects of food insecurity, whether it be churches, food banks, different departments within state government, trying to coalesce a lot of that together and make a lot of efforts. I think that's something that is everybody can agree on, that people shouldn't have that concern in our country and in our states. We're going to be working towards that. Along those same lines, too, I think we have very obesity rates in the state of Tennessee. We need to start promoting exercise for our children and having folks be able to. I often talk about being like smoking cigarettes. If you don't move, it increases your risks of heart attack and stroke. Tobacco is still a very high issue here in Tennessee. A lot of people do tobacco prevention and cessation. A lot of our kids are vaping these days as well. So trying to get education kids about the effects that can have on their lives as they get older. We promote a lot of cancer screenings, health care providers regularly make sure they're getting their breast cancer screenings, colon cancer screening. Again, an ounce of prevention is worth a pound of cure. We want to work on aging in place, on our maternal and infant mortality, dental investments. A lot of efforts have been made in the state so far to recruit dentists, produce dentists, people in rural care for folks. A lot of things to work on, a lot of things to make priorities. And as we're coming out of COVID, I know our department is ready to start moving on beyond that, on things that are just traditional to get people healthy and more prosperous lives.
Definitely a big. And just a follow-up for you, Dr. Alvarado, how is the overall health of Tennesseans, and are there things that each of us could be doing to contribute to overall wellness?
Yeah, so our ranking is not great. If you take overall rankings, we're a state that's very prosperous, great tax structure, a lot of economic prosperity, people moving from all over the country to Tennessee, which is really nice to see. But what keeps us from being a top 10 state is really our health rankings are not very good. And again, some of the things I mentioned, the obesity rates are high, nearly as much there. So making insured, underinsured people in the state of Tennessee. We're trying to work on, again, our infant mortality, maternal mortality, teen pregnancy rates, food insecurity, all those screenings. We want to do as much as we can on those things. What we can do is just to make sure, first of all, for our own children, our children watch what we do and often emulate what we do. And so the history tends to repeat it when it comes to health issues. The more we can kind of do good behaviors, our kids will watch that. If we can avoid smoking, avoid things that are bad for our health, exercise regularly, and get our same thing, I think that will gradually improve things. But it's just a matter of taking responsibility for that and making it a priority in our lives to make sure we take the time to exercise, get adequate sleep, and just lead things. And go to see your doctor on a regular basis. Folks wait until they feel something before they go. Get in to see your those recommendations, get screened things. And again, we know that if you can quit smoking and exercise routinely, your odds of success really of not having anything that's life-threatening in the future is very low. So we would those kind of hear our doctors talk about all this.
That's right. Great advice, Dr. Alvarado. I took a few notes here of things I've got to do next week. So thank you. All right, let's move over to Dr. Kripalani from Vanderbilt Medical Center. Dr. Kripalani, you've been practicing medicine for more than 20 years. What trends are you seeing with your patients here in Nashville? What questions are you getting most often?
Thank you for that. And first of all, thank you for inviting me to be here. I'm delighted to share some of the we're doing and to represent Vanderbilt University Medical. I want to echo all the things that Dr. Alvarado mentioned in that the epidemic of obesity and heart disease and diabetes are now here in Tennessee, across the Southeast. And I've been a practicing physician for over 20 years, most important to address. I think the food insecurity that Dr. Alvarado mentioned is a really important one. Not only the availability of healthy foods, but accessibility and to reduce the cost of those foods, because unfortunately, some of the most affordable foods at this point are still those that have lower nutritional value, fat content, and contribute to those health issues. So I think that's a really important issue to address. I think the good news, though, is that we are seeing people coming in asking about these things and trying to find out what they be doing to get healthier. And what's even more exciting is that on the medical front, we're starting to see more and more medications and treatment options that are available for patients that they're seeking to help treat not only the conditions, but also some of the underlying issues such as obesity. Obviously, a lot of this stems from our diet and our lifestyle, but those are difficult problems to fix overnight. And they stem from a lifelong trend of behavior. So behaviors are hard to change. And I think that it's exciting to see people becoming more interested in taking charge of their health. But it's nice that we have some medical science to help us along that pathway to get healthier.
Definitely tough to make some of those life changes. Doctor, and just to follow up for you, are you hearing much about COVID and even a thing we've heard about long COVID? How often is that coming up? Is that something we should be concerned about?
Well, that's a really important point because unfortunately, COVID is still a problem in our state. I think it's important to recognize that it hasn't gone away. Fortunately, I think it's evolved and changed since it first started early in 2020. It is no longer, in most people, quite the severe disease that it was when it first started, partly attributed to natural immunity that people, partly attributed to the vaccines that people have been able to obtain. And that's created a little bit of resistance to the virus, along with the virus itself mutating, which has made it a little bit milder in terms of severity of respiratory disease. Good question, important one, because it is one that we are seeing a lot. And one of the physicians at Vanderbilt who's treating and taking care of patients who are suffering with long COVID. It's a problem that's definitely here and probably going to continue to evolve and present itself over the next few years, and quite debilitating. So I think it's still important to for people to make wise choices about their health and still take precautions as much as possible to avoid getting it if they haven't had it.
All right, thank you, Doctor. And we'll get Dr. Davis in conversation. Dr. Davis, we know that you've been doing a lot of research around what drives health disparities, especially in the areas of cancer and Alzheimer's disease. Can you share with us some of the insights you're seeing on those disparities when it comes to health, and if there are any things that can be done to correct those?
Yes, I would like to also thank you for this opportunity to talk and share some work and things that I've learned as well. And so first I wanted to talk about, basically what health disparities are, pretty much inequities in the quality of health and health outcomes. And we've learned a lot about how social determinants of health, which both Dr. Kipperlani and Dr. Alvarado have alluded to in some of the cases where we eat, live, work, and play affect our overall health outcomes. All right, so some people don't have easy access to health care. And so it makes it a little challenging for people to get the necessary care that they need. So we want to kind of fill in these gaps to make sure that everyone has improvements in health outcomes. So while there's also social determinants, there are also some biological determinants of health and health disparities, and that's where my research comes in. Okay. And so when we think about, there are things like ancestry-related factors like genetics, factors like health, diet, and environment. And so we look to see what are these mechanisms that kind of drive these disparities so that we can find ways to offset them and improve health outcomes.
Thank you. And Dr. Davis, I know that you've also been doing a lot of work with Dr. Irvs to reach out to communities to both understand and address the community concerns about vaccines, and you've been doing that extensively. Can you tell us a little bit about what you've uncovered in that research?
Yes, definitely a lot of information. I think that that we hope will help change some policies and improve vaccine uptakes overall. One of the things that I think is important to realize is that COVID disproportionately affected minoritized individuals. It was what people called vaccine hesitancy, where people were just not sure if they were ready to get the vaccine. I was those people as well, even though I'm a scientist. I was a little hesitant at first until I saw the data and understood what the data meant. And so some of the things that we've learned, we've interviewed, we created community advisory boards to get insight on what the community, what their concerns were. And we learned that it varied, so our messaging had to vary. Not everyone had the same concern about for or against the vaccine, getting the vaccine. And so we had to address those concerns the best we could by conveying relevant information for them to make an informed decision. And so one of the other things that we've learned over the course of these interviews is that the messaging had to be catered to the concern of the individual, whether it was an adult or a parent caring for, deciding to vaccine for their child. And also that people want to understand the science. So I'm a basic scientist, so I work in a lab where I, tubes and try to figure out. And I just explained how viruses and vaccines work, and that helped alleviate some of the concerns of people who were emotional and trying to make a decision about whether to get the vaccine or not. The other thing that we learned is that people want a trusted and reliable source. I've gotten numerous calls from family members and friends in research, and they wanted to get my insight. But not everyone has access to a physician they can call on a cell phone or a PhD. And so we want to make these type of resources available for people. So we created to address these concerns that the public had, quote, yourcovidfactsfacts.com. And we're continually to evolve it, even though COVID is still affecting people still have.
Absolutely. And so important, as you said, to get the facts. And I want to bring Brad Hopkins in here just once more. We've heard about the importance of getting boosted. And Brad, I know this is something that really hits close to home for you. Can you share just a little bit of your story about why you believe that's so important?
First things first, Erica, Dr. Davis, I want your phone. We should all get by the end of the meeting. I my story didn't start out like some passionate campaign get involved in making sure that people were healthy. I can't say that it started that way. It was much like Dr. Davis. I really wasn't into vaccines. My wife and I vaccines. Now my mother in the next subdivision, them being of compromised health, they do get vaccinated, flu vaccines, the whole nine. Especially when it came to work, is that this is something that we have to be able to function in the household, to go into certain places that we want to be able to go to, or be able to need to work. We had to get vaccinated. We also respected my parents' wishes to, if we were going to be around them, to be vaccinated as well. But it wasn't. I contracted COVID myself unknowingly because my symptoms were as minute as a cold, and that's all I had. But I did notice that I did sleep for 4 hours after a workout, which is very uncommon for me. But it was then that I passed on my father and my son and a couple of other family members the next day at Thanksgiving. And it was, I had to trace it back to a massage that I had earlier in the week. And the masseuse was affected by COVID, gave it to me, and I gave it to my family. The unfortunate part is that my father had, with a compromised immune system, he spent 3 days in the hospital with 102 temperature. He has all kinds of issues to where he literally takes bags of medicine. He's the last person that he did. So it was then I was thinking it could have been so much worse had we not been vaccinated, because we don't know how the virus is going to affect us from one person to the next. We do know that those that have compromised immune systems may be more affected than someone like me, who I consider myself pretty healthy because I work out every day. You know, for myself, I just for the people around me that might am to make sure they were taken care of.
Absolutely. Thank you, Brad. Thank you for sharing that really compelling story there. Let's see. And now we want to take a look at the chat and see if we have some questions in the. I do see one here. To the physician experts on the panel, have you recommended that we get boosted? Oh, wait a minute. Let's see. Have you recommended that we get boosted? But I know have gotten their boosters, but they're still getting COVID. Does it still make sense to get the booster? So we hear that a lot from the public. I got boosted, but I still got COVID. Should I continue to do this? Any of our
I'll be happy to speak to that. So, people have to remember that vaccines are, a lot of folks think that, okay, if I take a vaccine, there's zero chance of catching a disease. And that's not the case. What vaccines are meant to do is to mitigate your risks. So a lot of times there's people that may have been vaccinated. It often will lessen the severity of the illness individual and hopefully will prevent it so that you don't catch it at all. It just depends a lot on your immune response, how much antibody levels the vaccinations, and the boosters increase those amounts when we get them. So we do recommend boosters because this virus, as we know, has already mutated a couple of times. The current variant that's out there is a different variant than was the original. We've all heard of terms like Delta and Omicron and those kinds of things. We'll probably see another one at some point in the future. Hopefully it gets weaker as it goes. But just like the flu that started back in 1918 and killed millions of people in this country, the flu is still around over 100 years later. And we recommend flu vaccines because every year that mutates year to year. And what the severity is going to be like. And so what we hope is that we guess correctly. Fortunately, with the newer technology we're using for these vaccinations, we can be much more specific on the kind of response we can get, that we can target these vaccines, particularly for COVID. But we do recommend that you get boosted. It just, again, it's not a guarantee that the statistics show that people who have been vaccinated have much, much, much less risk of death, much, much, much less risk of long-term problems, long COVID, all kinds of complications. And it gives you the best chance of survival, the best chance of a good outcome. People who aren't, just puts them at much, much higher risk. And the statistics have been out. So we do continue to recommend science that we know right now.
Kripalani, did you want to add a point to that?
Well, I think Dr. Alvarado said it best. So I agree with everything he has said. And there really is good data showing that the most recent booster that's being offered now, which is the first has both the original Delta as well as the Omicron variant vaccine in it, to be more effective against circulating strains. So that's all the more reason to get vaccinated or get boosted if you have not, because it's going to be more effective. And I agree. I think we don't fully understand what the long-term implications of COVID are going to be down the road. We're learning about many other disease processes that seem to have been escalated by COVID itself. So we're seeing a higher incidence of things like diabetes and even disease in people who have contracted COVID. So everything that we can do to prevent it, I think, is worth doing. So I'm still encouraging people to get boosted.
All right, excellent. And I believe players have a couple.
No, Dr. Alvarado had a response, Ms. Lathan.
As well, that I think a lot of people think that as doctors, we're pretty fancy with healthcare. We're pretty fancy with our studies and the things that we know. There's a lot of things that we still don't know in healthcare. And I remind people that, as we go, there's things that we do today. 25 was considered malpractice. Now, if we don't do it, it's malpractice. We learn. We have studies and things that we continue to evolve. So everyone thinks that, doctors have all the answers at any given of what we know, tells us what we should be doing right now. 200 years ago, treatment for a lot of this stuff would have been bloodletting. And we laugh about it now, but that's all they knew back then. That's what their experience showed them. We're getting fancier, we're learning. 20 years from now, we're going to look back at what we did. Some things we're going to say we got right. Some things we're going to learn as we go and continue to evolve. So based on what we know, that's what we recommend those things. And, obviously, physicians and nurses and people in healthcare want the best outcomes for people. We give advice based on what we know, best outcomes. And those are the intentions. I think there's a lot of chatter and noise around the intent of people with healthcare and advice, it's just based on what we know. And we're fancy. We don't know everything, but we're learning things as we go. And as we change, we'll probably change recommendations. Science and data show.
Which is why it's important to stay with the facts, talk to your physician, talk to the experts. And there's little time. If any of our players had an additional question, I'd invite you to ask it now if you'd like.
Yeah, if you don't mind. Oh, go ahead, Neil. Go ahead.
Just a quick question to one of the physicians. What are the symptoms you're seeing in long COVID right now?
I can take that question. We have seen a lot of patients. We opened up our long COVID clinic here at Vanderbilt in March 2021, and we have seen hundreds of patients thus far. I can tell you the number of fatigue. And the fatigue is something that far exceeds any fatigue that comes from a long day, an intense. It's fatigue that can last hours or days even beyond the recovery period from COVID. So, for example, we see people who 3 and even 6 months after having had not been able to return to their work, they're not able to care for their families. It can be pretty debilitating. I've had several patients who find that they get up, they have to go back 4 hours. So it can be fairly profound. Other symptoms that we're seeing are sort of lingering effects of COVID. So things like shortness of breath and rapid heart rate. There seems to be an effect that vascular affects people's ability to their blood pressure and their heart rate. And so they have wide variations in their blood pressures and even low episodes of blood pressure, and that leaves them feeling extremely fatigued. But the spectrum of long COVID symptoms really the organ system that we have. So there's really no system left untouched by this. Some people have milder symptoms, some people have more severe, but it's pretty widespread.
Thank you.
Of course. As we move forward, and people getting sick and what have you, do you suggest continue to get? Let's say you've been boosted, 2 times already. Is it a year, every couple of years, every other year? Family members or somebody who says, "Hey, I've got vaccinated. I've been boosted a time or two. Should I keep this? Do I need to keep this up each year like the flu, or at some point it's like, okay, I'm good, or are you ever good, so to speak?"
Yeah, we do recommend right now, based on what we know, we do recommend people to get annual boosters on these. And again, we encourage everybody to go talk to your physicians and your care provider because a lot of that experience is history. But we do recommend those right now. You start to see right now we still can get vaccinations for COVID, but as soon as the medical emergency is over, we know that President Biden's administration has kind of started talking about removing that state of emergency, that a lot of this is going to be reverted back to having to get vaccines paid for through your insurance or out of pocket if you don't have insurance. So it is the flu. There's, I think, big pharma is starting to consider manufacturing flu and COVID boosters combined into a single injection for people for ease to be able to get that every year. But based on what we know right now, we do recommend it because the variants mutate and they'll continue to change. And so based on when we get a new change, they'll have a new vaccine change in the virus to keep us high and keep people protected.
Can't let your guard down. And I think Brad's got one more question.
Yeah, I've just got a quick question. It seems that a lot of the concerns may not be more about COVID and how it contracts or its spreadability or even its effects, but more so the measures to protect ourselves against that. Maybe more the question concerning the vaccine. Are there any different? Basically, the way that vaccinations have been distributed to us, have been made for us publicly, how different are they compared to the ones that we've dealt with for, say, the flu or that have people seem to be really concerned term effects vaccinations may be, and maybe your answers could help answer some of those questions.
We'll open that up for any of our doctors that want to jump in.
Well, I think that there definitely has been quite a bit of hesitancy around vaccination, and I think this is, I think it's a combination of factors here. It was a infection that people were not familiar with. It was new. It was, I think, when it first came out, there was a lot of skepticism about where this came from, how did this come about, how is this being spread? A lot of fear, and unfortunately, I think that probably played a role in how the response went to vaccination. I think that we still have so much that we're learning. And I think, about this being an evolving area where we're doing things, we're taking interventions, we're coming up with treatments and vaccines, and then really this sort of stepping back and watching what happens, both with new strains in the population to see what the new emerging strains are. But there's a lot of aspects of this virus that are things that we've seen before. And one of the big ones is the rapidity at which it mutates and changes that makes it really hard to keep up with, how quickly it's changing. And so that makes it harder to create a vaccine that's effective. For the vaccines that we have out there, that you get it once and you're almost good forever. Things like chickenpox that we give to children now, and, even things like measles, and have a very long efficacy period, sometimes lifelong. We're unfortunately not seeing that with something like COVID. And so that's where we're in a position where we have to keep reevaluating, reassessing, coming up with a new vaccine, and then again, distributing it out to the population in a way that doesn't create fear and anxiety. So it's a challenging area with the way information disseminates nowadays, different than in 1918 or even 30 years ago. I think that really changes the field quite a bit when we're talking about masks and public health.
And I think I'll jump in here. I'm getting the sense too that from what our doctors have said in terms of overall health of Tennesseans, it's important to address some of those underlying health conditions so that what you encounter, your body's able to handle it. So keeping up that immune system and adopting healthy, probably important too.
Dr. Davis, you actually diets and things of that nature. Are there some things that people can do from maybe the things that they put? I always heard that the things that you put in your mouth affect directly how your body feels per se. So are there some things that maybe generally people can do to kind of keep a healthy per se?
Yes, nothing new. A healthy, well-balanced diet is key to everything, essentially, for health, as well as rest. Exercise doesn't have to be, I don't know, you do 4 hours in the gym, a walk around the corner. It could be something small that just gets you moving and your heart rate up so that you can burn calories. And so maintaining this on a regular basis will have a tremendous impact. And so a healthy diet overall is fruits and vegetables and moderation, right? And so a lot of our diseases can be exacerbated by the bad foods that we eat, processed foods and things that we eat in a hurry. But that's also complicated by life, right? So we have ever-changing responsibilities that we have to balance. But the more we can kind of maintain this healthy diet of increased fruits and vegetables and reduce significantly the chance of developing certain chronic diseases.
I have a question for one of the doctors as well. When it comes to gender, have you seen any in your studies or in your research that shows someone may be more susceptible to a certain disease or a certain thing more than others, or is it pretty much standard across the board?
I haven't seen any breakdown on gender difference on this. I mean, I think there's been a lot of studies done around vaccination. Talk about vaccines. There's two kinds of technology. The traditional Johnson vaccine, which you probably heard about, was a single shot. That was made kind of vaccine method. There was a lot of back when those were being originally used, a group of young women who developed high rates of clotting Typically, they were on birth control, and so there was some concerns there. Reported people have reported different symptoms and cases from different kinds of vaccinations. Those have all been researched and they're being continued taken seriously by the CDC. I know when they get reported cases, they review those to see if there's any severity with it. We haven't seen any difference, I don't think, on gender as far as, at least not in my experience, from the disease and equal opportunity. And unfortunately, there's been populations that have been more seriously hit as far as severity of illness from this. But as far as gender, I'm not aware of any breakdown on it. If Dr. Pipolani has seen any difference or not.
There are certain diseases that do have some gender predisposition. So I wasn't sure, Mr. Smith, if you were referring specifically to COVID or other diseases.
That was a general health. That was more of general health. COVID.
So, in answer to that question, there are most certainly specific diseases that do seem to have a slight predisposition toward certain genders. There's obviously some that are disease and organ specific that we know related to either male or female persons. But we know that, there are a lot of diseases out there that have an underlying basis in inflammation. And, really inflammation is one of those areas of science that we're really studying more and more because we think that it contributes to a lot of other disease processes in ways that we didn't previously understand. And those are what people commonly refer to as autoimmune diseases. And autoimmune diseases do have slight predominance. So we do a little bit more of this, and can be, anything from autoimmune vasculitis, which is like a blood vessel inflammation, to other immune diseases. Some have a small predominance.
For men, I know heart disease obviously is a risk factor also. Not that women, it's a big killer for women is heart disease. But if you're a male, when we kind of count up your risk factors, being a male, being over age 55 factors, it is higher for men on certain diseases as well. So there are some, just in general, there are diseases different severity and frequency.
All right, and I'm going to move our last question. Neil, I'm going to let you give our last question here.
So to one of the physicians, it's I train every day at my gym. I'm there probably 4 days a week, and it's usually it's all different women and males, and we discuss loss. And with the diets nowadays, there's so many of them. The Mediterraneans, there's actually and I know all the physicians are very familiar with this. There's a drug they're taking right now, diabetes, that is making people lose a lot of weight extremely fast. What is it? Intermittent fasting? Like, it just seems like we can never get. I know everyone's body's different, but there has to be something diet that works for people. Like, what is the new thing now? Because every time you turn on news or read something, different diet or a different drug or a different shake or a different something that you could take to lose weight. I'm just curious is there anything new? And I'm not a believer in that other the diabetes drug. I don't believe in any of that, but are some people that I've seen have taken that in my gym and they lost extreme amount of weight. So I'm just curious to see if there's a new one out there, or what one of the physicians may be recommending.
Well, I'm happy to take that question because I feel like that's the bread and butter of what I do every day. You're right. I think that there are so many diets out there, and it's really hard to tease out the differences between them. But there was a great study that came out a few years ago that compared numerous types of diet, the cabbage diet, Mediterranean. And the bottom line was all diets work. They all work. And people ate on every single one of them. The one factor was whether or not they could stay consistent with that diet. And I think a lot of them are so restrictive, either from a caloric standpoint or from the types of foods that you have, that no one could possibly stay consistent diet for more than a few weeks. And so that's fine if you are trying to get into, that cute outfit or get it, for your high school reunion, it may be. But the goal is really long-term health, and being able to lose that weight and keep it off long-term is really what it's all about. And so I think finding a diet that you enjoy, that you think you could continue to consume long-term, that is not overly restrictive and doesn't a single your life, I think that's going to be more successful, a higher likelihood of being able to continue it. And I think you're going to see the long-term weight loss results that you're looking for. So I always encourage my patients to look at the intricacies of the diet and see what really works with your lifestyle and with the types of foods that you eat. The diet that's going to you, don't fit yourself into the diet.
So the only diet that works is the one you're going to stick to.
Yeah.
All right. All right. As we wrap up this evening, I'm going to do kind of like a lightning round. I'm going to go around to each of our panelists and give you an opportunity just to leave us with your key thoughts, your key message, your key takeaway for our audience this evening. And limit your answer to about 15 to 30 seconds if you could.
I'll start. Like Neil was talking, Dr. Davis and Dr. Kripalani and Dr. Alvarado, exercise is so super important. I took it for granted, even as a player, how important it was. And it took me to how heart rate up, burn calories, and things of that nature. So watch what you eat, because what you eat is super important.
I'll go next. I'm a strong believer in finding the time in my life. First thing in the morning, if I first thing in the morning, my phone rings, I go play golf, I get a call from work. I never end up from 8 to 9 o'clock to go get my workout, and my day starts at 9. If I have to stay later and work later another hour, my boss is very well aware of that. All I know is when I'm mentally, I can attack the world. I feel so much better mentally. I'm done working out for 2 hours. And that's what I believe everyone should try, because mentally you'll feel so much better, and keep doing the exercise because it means so much to mental health.
Excellent. All right, Al, quickly.
Well, I always had a motto, when I played, stay ready so you don't have to get ready. So, with that being said, I echo Brad and Neil's thoughts on healthy, what have you. But if you stay ready, you don't have to get ready.
All right, excellent. Dr. Davis.
Just viruses, vaccines, viruses, and they're safe, just in case people are still having decisions about getting a vaccine. And exercise, you can start small. So do a 5-minute walk around the block or however long it takes you and build up to it. And that can make a significant difference, as we said, with continuing regularly.
All right, Dr. Kripalani.
My message would be that your health is your number one asset, and making sure that you're prioritizing that, doing the things that you can do in your day-to-day life, and partnering with a doctor who you stay in touch with, who can kind of keep you on the right track and help you make sure that you complete the health assessments that you need. I think that's the most important thing we can all do for ourselves.
Excellent. Now I'm going to give our Commissioner of Health the final word, Dr. Alvarado.
An ounce of prevention is worth a pound of cure. And that's an old statement, and it's really true. Too many people that put off because they don't want to know sometimes if there's something wrong. Don't put it off. Go see your doctor. Go see somebody that you trust. Talk to them about your health. Get screened on things. Catch things early, and it will pay off and enjoy your life and your family that much longer. Everyone will be happier for it.
Excellent. All right, that wraps up our show for this evening. We want to again thank all of our audience for tuning in. Thank all of our panelists for participating. If you'd like to learn more about the NFL alumni's work in this area or share the recording of the program with others, you can visit NFLAgearup.org/Tennessee. That's NFLAgearup.org/Tennessee. I'm Erica Lathan. Thanks for joining us. Have a great evening.